All right, everybody. We are back live with Jenna. And Jenna, welcome to the show. Thank you so much. Again, I don't want to make a big deal out of it because, as they say, you deal with these technical glitches and you just try to ignore them and move forward. But this was a pretty big one because our viewers got dropped. Everybody got dropped. And thank goodness we had our IT guy, Jerry Jackson, here to get us back up running quickly. But I know it probably frustrated some folks and we lost some folks along the way, but I'm hoping that once we kind of get all the technical stuff glued together and we get this thing looking the right way and we put it out there for consumption, I think we're going to have plenty of people wanting to listen in and hear both what Amanda Weish had to say and what you have to say. So with that said, I don't want to waste any more time. I want to get into talking about your segment because I think this is something that has completely flown under the radar. And I think it's important for people to understand, obviously, that the SMRCs this is not brand new. They've been around for quite some time. So real quick, I want to introduce everybody to Jenna. Jenna is special counsel with Nexon Pruitt. Jenna has been focusing her practice for almost a decade now on health law and health law related issues. I think when Jenna and I earlier had an opportunity to connect, we were talking about the fact that she focuses her practice on every 3-letter contractor to the Centers for Medicare and Medicaid Services. And beyond that, for those of you that don't know Jenna, as well as I've actually gotten to know her, and I've really gotten to know Jenna really over the last several months through our connection on LinkedIn. We share a lot of mutual connections. Jenna posts some fantastic information, lots of things that people as healthcare professionals, as leaders in your organizations need to be aware of. And it was just by chance I came across a post that Jenna did talking about SMRCs. For those of you that aren't familiar with those, they are the supplemental medical review contractors. And there's only one at this point right now, and it's Noridian, and we'll talk about that. But Jenna actually is a former district attorney and prosecutor in Chicago, which I think that was probably a really cool place to be a prosecutor because there's no shortage of interesting characters roaming around in Chicago. And, I've had cases in Chicago. I have one going on right now with a client, and we're in discussions with the DA, hoping that, we could convince them from moving forward with their case because, as we're going to talk about, they contract out with some consultants, and sometimes they get just as bad of information as what physicians get sometimes with contracting with people who, maybe they're trying to save a few dollars and they've price shopped and this consultant seems to be the cheapest. So that's the way that I'm going to go. But with that said, Jenna, I want to welcome you to the show. Thank you so much. Let you kind of introduce yourself a little bit beyond what I've tried to do to our audience so they really have a good flavor for who you are.
Sure. Thank you so much. First of all, I'm pretty sure the technical difficulties are because I am on your show. I seem to be the grim reaper of Zoom call technical difficulties. So I'm laughing with you, and there's nothing we can do. And you guys did a great job seamlessly transitioning us back on. So good job to you and your crew.
Thank you.
I thoroughly enjoyed listening to you and Amanda talk earlier. It's refreshing to just talk to people who can break down really complicated healthcare issues so well, like Amanda did. And I learn a lot every day. I've enjoyed listening to your podcasts in the past and was very humbled when you asked me to join today. And I'm Really excited to talk about this not new, but newly rejuvenated, we should say, SMRC audits that we see happening right now.
Yeah,
Um,
I think.
so I,
Yeah, go ahead. Go ahead. I'm sorry.
yeah, I think it's interesting. We talked earlier about we don't know why CMS does what it does, but it does seem from my practice and my colleagues' practice at Next and Pruitt and talking to other healthcare attorneys and providers that since CMS resumed auditing after the pandemic ended, per CMS, um, SMRCs have just been rampant. Before the pandemic, most of my new cases were UPICs, RACs, TPEs, and now all of a sudden it's all SMRCs. And so I really want to get the word out, which is why my colleague Alex Harris, my mentor at Nexon, and I drafted that article about SMRCs. We did a video presentation about it. We really, and this is another great opportunity to get the word out because providers need to be prepared because they're just really, CMS is really ramping it up right now.
Yeah, I think, and it's really interesting. And I think we could draw a parallel to that, right? Because as you were talking about the SMRCs, it started making me think about the ramp up when the targeted, probed, and educate program first came onto the scene. What was that, like in 2017 or something around there? And
Right.
I think there's some obvious similarities between the TPE program excuse me, and the SMRCs. Now, obviously, with the TPE program, you have multiple phases that you could go through, right? Phase one, phase two, phase three, and at each phase, you have an opportunity to be able to engage with the reviewer who performed the audits to talk about what they thought were problematic issues with your documentation, your coding, etc., prior to moving you to the next level. But just like the SMRCs, their audits don't change. You don't get to change their audit results, right? So the only way you can do that is through an appeals process, right? Through a redetermination or reconsideration to try to lower that error rate down to that 20% level or below 20% so you don't have to go to the next level. With the SMRCs, there are no multiple levels, right? It is
No.
it is an audit, and then once you get your letter for your review results, you have a 30-day window of opportunity to be able to engage in a dialogue between your practice, your counsel, your consultant, whoever you have working with you, and the auditor at the SMRC. But they're not going to change the results of their audits. You still have to go through the appeals process, right?
Correct. And it's really a short window. You only have a 14-day window if they offer it to you to possibly get education, which obviously, as an attorney, I would always recommend that providers use any opportunity they can, whether it's going to change the audit results or not, to try to understand what auditors are seeing is problematic with their billing and documentation so that they can avoid future audits. But yes, it's a short window. You can also, during that time, ask to submit supplemental documentation if your records were not complete at the initial production, which sometimes can help change some of the results. But it's very important to have an attorney involved in the process immediately upon getting that green envelope that we talked about. There's a very distinctive, let's talk about the process a little bit. There's a very distinct green envelope with a Noridian label that a provider is going to get. There's only one contractor for the SMRC, and that is Noridian. They conduct nationwide reviews on projects that CMS designates to them to investigate different coding services. And we can talk about some of those later. But as we discussed, Sean, it doesn't necessarily have to be what they're outlining on their website as their current projects. At any point, different investigative agencies can go to CMS and ask them, like such as the OIG, can go to CMS and say, hey, I want you to look at this type of provider. I want you to look at this type of coding service that's, we think is problematic. And so just because, I guess I'm saying this because I want providers to know that just because they're not on the current list of projects doesn't necessarily mean they're immune from an SMRC at this point.
Yeah, I
So it's
think
really,
that's so critical, right? Because as you said, they're not just bound to the projects that are put out in the public domain right now. They could be tagged or tasked by, I think we were talking about, it's up to like 7 different governmental agencies, including the OIG and the Governmental Accounting Office, the GAO, to engage in looking at information, specific to something that the government is seeing. And I think that takes us into part of the conversation where I'm hoping you're good with going, which is data, right?
yes.
You know,
Yes. So
yeah,
providers get tagged because the CMS is constantly having different entities data mine for them. And if a provider is an outlier compared to their peers, then they can be tagged. That is usually the reason they are tagged for an SMRC audit. And there can be benign reasons that you are an outlier. It could be because you're the only specialty provider in a rural area. So of course you're going to be billing, a certain procedure code more than your peers. So, there are reasons that people can be outliers, but the bottom line is once you've been targeted and subject to the audit, if they get in there and start requesting your documentation and it's not up to par, it doesn't matter why you were picked. You can't get out of it because you were unjustly picked as
right.
an audit target. If your documentation is bad, they're going to recommend overpayments to the MAC. It's going to lead to potentially more audits, and you're in that vicious cycle that you don't want to be in the CMS administrative appeal process.
Yeah. One of the questions that I had for you, and you actually just mentioned it, was the green envelope, right? Because it's really truly distinct from anything else. And it was interesting because, I spend my days involved in really, CMS MAC audits and RAC audits and UPIC audits. I've had one run-in with the SMRC, and it was kind of an interesting story, and we can talk about that if there's time a little bit later on. But I think it's really interesting, and I think you gave a really interesting explanation to me, or at least what you thought was the rationale behind why they use that green envelope. Could you share that with our audience?
I think their intent is to make providers understand something big's coming in the mail, but unfortunately, a lot of providers' office staff or whoever gets the mail, I've heard so many stories of it just being tossed because, they don't know, they're not educated. And that goes back to our proactive theme of the day. It's so important to have, be talking to your staff, people to understand, what to look for, because, you can't throw, if you throw that away, you're in a lot of trouble because you've missed. Providers can't miss deadlines. CMS, unfortunately, Noridian, I've seen in the ones we've been working on, they're not necessarily sticking to their deadlines as far as, okay, we're going to get you results within 60 days. And there's nothing a provider can do. But if a provider misses a deadline of turning in documentation within 30 days, they're toast. There's nothing.
Right. So Sean and I can identify with that. We just got a letter from a 3-year-old appellate case that was missing some information. And so now all this information was submitted, mind you, in 2018, and they were like, please respond within 20 days.
Wow.
Yeah.
I do have a question. I wanted to ask a quick question. So one of the things that you had mentioned was the supplemental period to submit additional information. Yes. Related to the claim. And the reason I want to ask this question is I do a ton of audits, not for any 3-letter acronym agencies, but the provider's first question to me is often more of a statement than a question, but it's like, well, I can fix that. I'm just going to go into the note and type in whatever is missing. And right. So it seems like a silly question, but I cannot tell you how many times when I go to the provider and I say, well, this is what's missing, the provider's response is, well, I'll just put it in. How would you respond to that?
That is illegal. Providers cannot alter documentation. You're stuck with the medical record that has been created. You can submit, CMS will allow an attestation to be submitted. Say a provider didn't sign a chart note or, didn't document something correctly, they can submit an attestation that's attached to the medical record saying, I saw the patient on this day, these were the services performed, but they cannot alter any medical record.
I like to use clinical summaries. So it's not really a late entry. It's not really an addendum. It's a clinical summary. And I think Scott, you ask a really good question. I think Jenna, I'd like to get your thoughts on this. Provider documentation. If you talk to a nurse practitioner, a PA, a clinician, and they're a purist, right? We're not talking about insurance companies or payments. We're purely talking about clinical documentation. They're going to tell you, I document for myself. I document for basically another provider to be able to understand what it is that I've done clinically for a patient, diagnostically, therapeutically, so that they can, if necessary, assume the care of a patient in a safe and prudent manner, right? But the point that we're trying to get across to providers is that that's all and well, and I understand that you have to document for med-mal reasons, but guess what? You're also documenting for that non-clinical reviewer at an insurance company who's making a determination on whether or not your services were, quote unquote, medically necessary.
Right, and CMS gives you the tools you need to understand for every code with their LCDs and NCDs, and this goes back to proactive compliance and educating whoever, your providers that are documenting their services to make sure that they are meeting the documentation standards needed to support the codes being billed, and that your billers understand if they look at a chart and those documentation requirements have not been met, that they're not going to bill for something that's not supported. So that is, if I could change the nature of my practice, I wish it wasn't focused on helping people get out of these appeals. I would love to focus my practice on educating providers and their staffs on how to proactively implement living, breathing, as we talked about, compliance plans, that constant education and looking at payer policies and what is needed to support the services and bills, that the codes that they're billing.
I think you talking about, changing the aspect of your practice to be, to being more proactive, like you were saying. I think that actually falls in line with something that you and I had a chance to talk about a little bit earlier, and I'm not really interested in talking about the statistics and all the numbers and those kind of things, but there was something that really stuck out to me, and there was a GAO report from 2016, and a lot of people were like, well, this is 2021, why are we talking about 2016? Well, because their review period was 2013 and 2014, and it took them that long, the GAO, to be able to compile all that information and structure a report before they could release it. So it's quite possible that over the last 2 years or 3 years, they've been recompiling some of this information. And with the fact that we were in a public health emergency in 2020, it just didn't get pushed out. And it may be something, we may see some updated information. But the correlation, Jenna, that I wanted to draw to what you were talking about, if you could change one thing about your practice, to CMS, is this. In that GAO report, they were talking about the fact that if CMS would get away from the pay and chase, and they would follow the steps that the recovery audit contractors have taken, which is the prepayment reviews, they could become more efficient. It would cut down the number of backlogged appeals, all those kind of things. So I think this completely fits into our theme today, which is being proactive, right? So from that perspective, can you talk a little bit about what it is that providers should be doing in anticipation of a SMRC letter showing up on their doorstep? I mean, what are the things that if I were reaching out to you and I were saying, Jenna, I'm the administrator of a 5 doctor, 6 doctor, 10 doctor, 2,000 physician group. What are the things that I need to be focusing on with my staff and my providers to begin the process of risk mitigation?
Well, the most important thing, I mean, is making sure that your compliance plan, identifies specific procedures internally for auditing, self-auditing your claims and your documentation. You need someone on your staff, or you need to hire a competent third party that can conduct quarterly audits of your billing and your documentation, and then educate your providers on how to get better, and potentially identify your risk before you're targeted by, whether it be CMS or commercial payer. um, that's just so critical. And if providers would do that properly, they could stay off the radar.
Yeah.
It's that simple.
Yeah, and it really is simple. I try to explain to people all the time, as complex as healthcare is, there are so many simplistic things that you can actually do that are really cost effective. And tripping over, dollars to pick up dimes is not the way to do things in healthcare. And the proactive thing that we're talking about is compliance programs. Um, there's a lot of people out there that you ask them if they have a compliance program, and they're like, I do, I have a compliance program. But then you ask them, is it an effective compliance program? And they have to stop and think, and they look at you as if to say, well, what do you mean by effective? Right?
Yeah, it's not just a book sitting on a shelf. You have to have a really good compliance officer at any level, whether you're, a couple provider practice all the way up to a hospital system. You've got to have the right people in place that understand what needs to be done to monitor your billing and your documentation.
Yeah. I think the days of people trying to build, in all sincerity, a lot of the governmental agents that I know, prosecutors that I have relationships with over, the course of my career, they've gotten really smart, right? And, so my point here, and I want to get your take on this, obviously, as a health law attorney, putting forth this 1,000-page document, thinking that you're going to impress an investigator or a prosecutor, it is just a fallacy. To me, I try to keep it short and sweet, right? There's no need to have a 1,000-page document for a compliance program. I mean, what do you think?
I think it's much more impressive if you're targeted for an audit, if you can not show them a piece of paper that says we do, monitoring and auditing, but if you can show them, okay, 3 months ago, we audited this particular procedure code, and this was our results, and this is what we were told by, this qualified consultant, that it's okay, it's not okay, whatever. That is what might help you mitigate, especially with a commercial payer. It's going to help if you have that kind of evidence to back up your compliance plan, actual implementation of it, and showing that you are trying to be compliant. You're not just sitting back, you're trying to understand. And you have you on this day, I met with all our providers and we talked about the new policy that Aetna put out, and we discussed the proper documentation of the code and when it was appropriate and when it wasn't. That's good stuff.
Yeah.
Not a binder full of dust.
Yep. So in the last couple of minutes that we have together, what else do our listeners need to be aware of with regard to the SMRCs?
Be aware that they're very active right now. Be aware that if you are in one of those groups that has been identified as a project, yes, they're not limited to those categories, but your risk is definitely much higher if you have been identified. Personally, at my firm, we are seeing a lot of hospice providers targeted with SMRCs. There's a lot of skilled nursing facilities. Um, that's what we're seeing. But there's probably about 15. If you go to Noridian's website, there's about 15 specific target areas right now. So if you are one of those areas, I would really start looking at getting some auditing, self-auditing done pronto to make sure you're going to pass scrutiny if you do get that green envelope.
Absolutely. And real quick, for those of you that are going to head out to Noridian's website, just to give you a quick understanding of some of the services that are actually under the project scope for the SMRCs right now. Durable medical equipment supplies in non-covered SNFs in skilled nursing facilities. Obviously, DME is always a huge target. We see it a lot. Jenna, I'm sure you guys see a lot of DME audits that are taking place. Inpatient rehabilitative facilities, skilled nursing facilities, to Jenna's point just a couple of moments ago. Therapeutic shoes for diabetics, intravenous immunoglobulin, IVIG, Botox, DRG. This is an interesting one. DRG COVID 20% add-on payment. Boy, I'm telling you what, it's one thing to get in trouble for, not complying with a policy or a procedure. It's a whole different ball game when you get in trouble during a public health emergency where you got caught taking advantage of the government.
Yes.
Yeah, that's not going to be a great newspaper headline for you.
Yeah. So there's a really great bit of information that's out there on SMRCs. I think, Jenna, you gave us a great high-level understanding, a great foundation for people who are compliance officers, attorneys, healthcare leaders who really have created a culture of compliance within their organizations, a great starting point to now go forward and prosper, as they say, and find more information. And here's what I would like to point out. Somebody did a really nice job the other day on LinkedIn of recognizing individuals who are resource authorities. And Jenna was listed as one of those people. And Jenna's very humble. So Jenna's one of those people who says, "Hey, wait a minute. I'm out here learning as much as anybody. I'm just trying to, I'm trying to get." But and she is, and I think that's what makes Jenna such an incredible resource, is that she's gathering knowledge from different authoritative sources and is able to translate that and disseminate that information into usable, readable formats instead of the typical stuff that you see from a lot of attorneys who are trying to impress you with big words. I think Jenna does, I think she does a tremendous job of this, and I am forever grateful for the relationship that I've been able to build with Jenna to this point, and I look forward to doing that in the future. And as always, I always like to give our special guests the final word. And I know, Jenna, you probably have a couple of final words that you want to put out there to our audience and to our listeners. So let me go ahead and button it up and turn it over to you for the closing comments on your segment.
Thank you very much. I just want to reiterate what you and Amanda and I have been saying this whole podcast, which is proactive, proactive, proactive. I have so many clients that if they could go back in time would change so many things they did, because once you get caught up in the CMS administrative appeals process, it can be absolutely an unfair, devastating process for providers. And if they could do anything, they would go back and change their compliance habits and how they handle things. I also want to say, don't panic if you do become the target of an audit. Get help. There's help out there. Sometimes getting help right away and just making sure your records are organized before you send them in to the auditor is critical. We've seen a lot of our clients who just don't get advice send in the 1,000-page record, all, mismatched, not organized in a proper way. And auditors aren't going to comb through that. They want to see the dates of service. They want to see, for hospice, they want to see the certification periods they're looking at. They want to see the orders. And if you can organize that well at the beginning, sometimes you can stave off a lot of claims if you put in front of them what they want to see. And a good attorney or a good consultant will know what they're looking for.
Yep.
And how to organize it well. So again, a little bit of proactive expense at the beginning of an audit can sometimes make that audit go much, much better.
Yeah. And I think I'll just close out with saying, as I said before, tripping over dollars to pick up dimes is not the way to go about this, whether you're talking about compliance or you're talking about getting proper representation if you've been targeted for an audit. So, Jenna, thank you so much again for being on the show. It's been an absolute pleasure. I've really enjoyed it. I hope that you'll consider coming back again.
Love it.
And for those of you that stuck around and rejoined our live stream, thank you so much. We're going to do some cleanup on the back end here. We're going to take the YouTube page down for just a little while. We're going to put these two segments together, crop out all the nonsense that happened, and give you guys a good final product. So with that said, thank you so much for joining us on episode 3 today of The Compliance Guy. Don't forget, we'll be back in July with attorney Matt Lahan, who will be engaging with us in a conversation about the Unified Program Integrity Contractors. I hope that you'll join us in July. We'll be posting our date that we'll be pushing that episode out on LinkedIn. Again, thank you so much. Take care, and we'll see you in the future.